welcome to the January 20th media briefing here. Really appreciate again you all being with us. And I hate to start off with this stark news, but the death toll continues to climb. I think the last time we were together 2 weeks ago, it was at 234. We're now at 309, some 75 more deaths in between the 2-week period. It's just unfathomable. And during this surge, we're just seeing such a dramatic change with over 32,887 now who have had COVID-19 in San Mateo County. As you go to the next one there, thank you. We can see that we have 189, I think it's an all-time high, hospitalized with COVID-19, 185 confirmed. You can see where the acute care beds in the county are down to 12. Our ICU beds are at 4. We did, in fact, stand up, I believe, 10 beds now through our partners, additional ICU beds using an AMI, but and those beds are full. I understand we have 5 in county, 5 out of county, but it's certainly a relief valve for us for these beds, and it was definitely necessary to get those up and running. You can still see that we do have the surge beds available, but again, and ICU beds, but again, that depends on the availability of staffing. So total residents tested now are reaching just about 380,000, which is an amazing number when you think about it. The testing continues to be one of the primary pillars that we have in regard to battling COVID-19. With last week, 10,745 individuals being tested through Curative and Verily. And that varies according to locations, of course. A little bit in regard to the regional stay-at-home order and the blueprint for safer economy. The stay-at-home order in the Bay Area region, ICU capacity, the state was reporting at 7.4 right now of ICU capacity in the Bay Area. It was 7.4. The current tier changes were determined based on data from December 20th through the 26th, 4-day lag. And in here, we're talking about the adjusted case rate of 31.4 as of yesterday per 100K. I mean, what a dramatic change that has been over those just a few short months. And the unadjusted case rate of 62.9 as of 1/19/29. And the positivity has come down just a little bit in the last 2 weeks to 6.5. Testing update, we're still one of the leaders in the state in making sure that we do get out there. I mean, it's amazing that we're testing over 1,100 per 100,000 people. I thought, I thought it was a stretch when we were looking at trying to get to 300, and here we are at 1,100. We continue to be one of the main leaders in the state per 100K. And we're moving those sites around to make sure we try to get all parts of the county, give everybody the opportunity to get tested that needs it. Some announcements, the event center site, because of increased need for use of the event center for mass vaccination, the EOC is currently working on finding alternative sites for COVID-19. We will let you know and publicize that well in advance if and when we do that. Just a little bit more about the vaccination. Obviously, we are the safety net providers for the county, and we're charged with making sure that we vaccinate those in the safety net. We have about 70,000 through the San Mateo County Health, and then there's probably another 70,000 or so that fall into various buckets that we're responsible for or will help provide resources to make sure that in the way of distributing doses that come to us to them, to make sure that all of them are also vaccinated. We did get up and running. I believe we're one of the first in the state over the last week to operate the drive-through vaccination center. It was really a proof of concept. Sarija and the team at Health did a great job, along with Ileana and Dan Belleville and the EOC and the Sheriff's Office and everyone coming together literally in 48 hours to put this together. And it's just hard to explain to you here all the logistics and the heavy lift that was. But I was just so proud of the team, seeing, where they started last Saturday through the week, how they progressed from 400 to almost 2,000. And really, we believe that we could reach 3,000 if we had the doses and if, we had the population, the ability to reach that population and get them there that we're responsible for. But we will be teaming up in the near future as soon as this weekend with another healthcare provider to do more drive-through vaccines in a mass way. And we will also bring in Pfizer, which is a little bit more difficult to deal with at a drive-through mass vaccination drive-through site because of the need for pharmacists to reconstitute it and some of the logistics around getting the doses together. But we believe it can be done. And again, San Mateo County likes to be out in front and do things differently. And I have no doubt that we'll be very successful in doing that. And really more to come on that. But it was just really an incredible sight to see this group working so hard with people, and with tears in their eyes, coming up and thanking the healthcare workers for giving the vaccine. And I had an opportunity to address the healthcare workers and the volunteers at that site. And what I told them was how proud I was of them and what this vaccine really represented. It's just not a shot in the arm. It is a shot for hope, really. It's a hope that there'll be some normalcy back in their lives, that businesses will open, that people will get back to work, that schools will open, and kids will get back to learning in an atmosphere where it's conducive to making those friends and interacting with one another. It's really about grandparents, seeing there and being able to hug their grandkids again, and having loved ones with them, and certainly when that time comes to pass, to not pass alone. It's just so rewarding to see that many people come together and give them those shots of hope. It was just truly inspirational and really marked the beginning of the end of COVID-19 as we know it. So the business engagement team has been very active. We've had 1,170 complaints, with 82% of those abated. The past 2 weeks, the number of complaints has increased to just about 100. So things are slowing down there. A lot of things are closed. 120 warnings, 28 administrative citations have been given out, which amounts to about just under $30,000 in fines. Obviously, it's the same cities we talked about, the bigger cities where we're seeing most of the complaints: San Mateo, Redwood City, Daly City, South San Francisco, and it really has to do with not wearing a mask and not socially distancing. On the health facility numbers and shelter, the good news is we have received official word from the U.S. Treasury Department that we have received approval to receive $22,791,546 million in emergency rental assistance funding, which was approved by Congress in December. This is great news for those in need of assistance. We will be making some allocation funding decisions here in the near future and put together a framework of how that program will operate and be distributed. So more to come on that, but good to know help is on the way for those just living on the brink of homelessness. The Great Plates program continues to thrive with over 1.4 million meals being delivered now. And Lisa Mancini and the team has just done an incredible job getting these meals out and getting so many people served. 3,796 recipients with 75 active restaurants. And really, that again signifies people working, restaurants staying open, that money coming back into our economy, and people in dire need being fed. So just a remarkable program. Mask distribution, 634 masks were distributed last week. You see that vehicle out all the time now. It's great to see it in the neighborhoods, and the fact that people are still going up and getting masks, which is so important. And even as we get people vaccinated, it'll remain an important focal point for people to continue to wear those masks. Just almost 20,000 masks distributed to date. We have an event, Facebook event coming up. I want to share that. So this is a Facebook Live series collaboration with the Sheriff's Office in Caron. Will air on January 26th, discuss the COVID-19 vaccination process. It'll be a live interactive program. Another thing to announce today is that I've had a lot of requests for how people, especially healthcare workers, can volunteer. We will be in need of volunteers who can vaccinate people, I'm sure, in the future. And we don't want to just, when that time comes, when the doses free up and we see this flow and we open more sites, we don't want to be, then calling for volunteers. So what we're trying to do is get those volunteers on a list now, vet them, get them credentialed to the extent that we can, so that we can go through and get them out quickly when we do need them. In some places we'll need them, and we've had some places ask us already. We could certainly use them at Mass Vaccination Center because we have been using public health nurses who have all kinds of other duties that require their attention also. So we can't, use them for both things on an ongoing basis. But we will have that volunteer opportunity for those who are physicians and surgeons, nurse practitioners, physician assistants, registered nurses, nursing students, medical assistants, pharmacists, pharmacy technicians, dentists, optometrists, podiatrists, and students in medical or pharmacy programs. We will ask them to sign up and volunteer so we can make sure that we have in order all the things necessary for them to be placed when that time comes. And there is a lot to that, believe me. It's just not a matter of people signing up and being assigned someplace. There's credentialing that goes through with it and verification and all kinds of things. So Connie, we'll get that website out to you where people can volunteer. We've had a lot, I can tell, a lot of interest in it so far. People are contacting me, emailing me. We see it on Nextdoor a lot, people asking where they can sign up. So we look forward to that. And I think there'll be other opportunities as we do in the future, ramp up mass vaccination sites for people, whether they're flag people or people to help register. There will be opportunities in the future, which we'll put out at that time. But with that, I think that there are some questions that we have. San Francisco just launched vaccination figures on its dashboard. How close is San Mateo County to incorporating something similar? We are very interested in this. Sarija, can you update us as to where we're at with this?
Yeah, we will have some information on our website, our COVID vaccine website, by next week. There's a lot of messiness in the data that we're working through and want to make sure it's accurate before communicating to the public in a way that's really aiming to earn trust and keep trust.
Okay. Another question, did the county receive any doses of Moderna vaccine batch the state has recommended be halted due to severe allergic reactions? I don't think we did as a county, but Sarita, do you have more information on that? I know we have it in the county.
Right. I can confirm that the lot that had to be paused was not used in any of the doses directly allocated to the county, either for our administration or for redistribution to other healthcare partners. We did quickly poll the multi-county entities that operate in our county to ask if any of them were affected. And we know that 3 of them were and had to pause those Moderna doses and figure out a plan B to keep up with their vaccinations this week.
Great. And then the last one, this one would be for you, Sarija, also. Have either of the 2 new COVID variants been spotted in the county, and how concerned are officials of their spread?
Our public health team expects that these variants are in San Mateo County just as they are in other parts of the Bay Area and across the state. We remain in a period of widespread transmission. These variants are more transmissible, so the contagion is greater. So this is a period where we all have to keep with those precautions, always wearing our mask in public, isolating at any sign of exposure, seeking a test if you think that you might be positive. This remains a period of widespread transmission, and these variants make it even more important to adhere to those precautions.
Great. Okay, with that, why don't we open it up to see if there's any questions?
Henrietta.
Henrietta, how are you?
I am fine, thank you, and I can see you all are too, I hope.
Yes.
Sarija, you mentioned the Moderna vaccine, and we've been hearing of some adverse reactions to it, especially in LA. And I'm wondering, is it the one that San Mateo County is using? Have there been any reports of adverse reactions? And given some of the deaths of the very frail in Norway, are there any considerations of restricting the vaccine to some of those who are very frail and elderly?
I'm not sure if I understood the last question, so let me start in order. So the specific lot of the Moderna vaccine that the state requested to be paused does not affect the doses that San Mateo County is using or distributing. That was the same question that Mike began the answer to. There were a few healthcare entities in our county, 3, who needed to pause some of their doses. And what we understand, there should be more information from the state this week, is there were allergic reactions at one site in which Moderna doses from that specific lot were used, and they haven't heard evidence that there were other instances. So they're considering, were there conditions at that specific site, and in the way those doses, could it be around the temperature? Are there any other factors at that one location in which 10, I believe, allergic reactions were experienced? We do speak regularly to healthcare providers who are vaccinators in our county. We have a weekly call with them. Overall, the experience with both the Pfizer and Moderna vaccine has been quite positive. And, you know, the safety and efficacy of these vaccines, the clinical trials were extremely positive, as Dr. Fauci and other medical officials have reinforced, and that has been the experience locally. In terms of the fatality in Norway, I don't think I know that one, Henrietta, so you might have to educate me.
Well, there were some reports that some very elderly people who were given the vaccine died. And it might have very well have been related to the vaccine. So officials in Norway are being very circumspect in terms of the elderly people to whom the vaccine is given. So I'm wondering if there are any considerations like that.
Well, we absolutely, you know, safety and following the science is the absolute priority in the rollout of the vaccine. And we receive our guidance from federal and state officials, as well as any local experience that would give us concern. The older adult population, there are many underlying medical factors that could contribute to risk. And so isolating whether it is the vaccine and what we can learn from Norway, which I'm sure CDC officials are learning actively, you know, as we speak, we typically get that guidance from the other levels of government and their scientific advisors whose experience and expertise we rely on.
Thank you.
Okay. Anyone else?
No one else with a raised hand at this point, and at this time, no questions in the chat.
Wonderful. Thank you all for being on. Stay safe, and we will be back in 2 weeks. Take care. Hope to see you then.